It's indeed my honor and a great pleasure to address you and make this presentation to you on this very special occasion. My name is Dr. Wofa, and I'm an assistant at the Department of Morphology and Pathological Physiology. And today I shall be talking to you about the role of immersive technologies in medical education. Next slide. So I will start with a little bit of history, because history always gives us the information to make us appreciate how far we have gone as scientists, as medical personnel, and of course, in general, as a human race. By the left is an image of Galen. Galen was a very famous Greek anatomist and physician. This is him giving an anatomy lecture in 129 AD in Rome. And behind him is his assistant. Time passed. By the right, you can see a presentation or anatomy lecture by Nicholas Tulp. He is a Dutch anatomist and a really famous surgeon. Here he is performing some anatomical dissection, and behind him are enthusiastically his students. What is very interesting about this case is that during his dissections, he used prisoners who were sentenced to death by hanging. And most of his prisoners, unfortunately, were males. And this dissection was really famous in Europe, and doctors, professors from different parts of Europe always came to have like a good view and participation of this. About in the evolution of morphology, not globally this time, but I present to you the prominent Ukrainian scientist, Professor Volodymyr Apanasovich Karavayev. He was the first dean of the medical faculty of St. Vladimir University, which today we refer as to Taras Shevchenko University. And here is the first head of anatomy department in Kiev. He is Mykolai Ilyarnovich Kozlov. Here is him giving lectures to students at the newly founded medical university. So if you want to read more about the evolution of anatomy or medicine in general in Ukraine, you can as well go to this museum. It's located somewhere near to Metro Tetrana, if I'm not mistaken. And here is a little bit about our department, how it has evolved so far. But to save time, I want to concentrate on what happened on February 2020. So we opened the modern virtual reality auditorium. And today, this is what I will spend most of my time talking to you about. And of course, this is the head of the Educational Scientific Center. What about immersive technologies? What do we understand by immersive technology? Immersive technology is just an integration of virtual contact with physical environment. But if it's complicated to understand, I can explain it differently. So it means that the user accepts virtual elements of their environment as a part or a whole. So potentially, the user becomes less conscious of his temporary or contemporary environment and accepts those visual illusions as real. So this is just another way to give you an example of what immersive technology means. And of course, here is an illustration that shows you the real world. The use of some virtual reality and some head device and your virtual environment. But anyway, this scheme will be a little bit complicated for you if I don't give you the next explanation. So what type of realities can we have? We have the real reality, and this real reality means what you are feeling where you are right now. So the computer you are touching, the people you're interacting with, what you can see through your window, and so on and so forth. These are regarded as your real reality. But virtual reality simply means a digital environment that replaces the user's physical environment. So just imagine if I change the environment you are currently viewing, so it's actually a virtual reality. And the other type of reality is called augmented reality. So augmented reality simply means an enhanced version of this real world that is achieved through the use of some digital elements, sound, and so on and so forth, which I will show you in the course of this lecture. A mixed reality simply means a combination of different kinds of realities. For example, virtual realities plus augmented reality. And finally, extended reality is just a common name for the combination of these realities. So what does virtual reality mean? Here is an illusion of a new environment, a creation of a new environment to your own real environment. And you can mostly access this with mobile devices, for example, your iPad, sometimes your computer. So this is an element of augmented reality. Whereas virtual reality, as you can see, you primarily use some devices like headsets and you are immersed. What it means immersed means that you are being submerged into this experience. And what devices do we need to have this feel of immersive technology? We have some helmets or some Oculus helmet and manipulators and, well, a computer. That is enough. This is a photo of our students who is well kitted and ready to have an immersive experience. And these are also students who are getting ready to have this interesting journey of immersive reality, of immersive technology. And about immersive technology, this technology is not really new to most of you because you can see this is widely applied in video games and entertainment industries. However, this has been the common standard for a long time. But it doesn't mean that other people didn't try to invent this method into medicine. In the year 1965, Robert Mann tried to bring up this system in medicine. However, especially in orthopedics medicine. So this was the first trial, 1965, to introduce virtual reality into medicine. And at our department, we are lucky to be able to provide this technology to train our students. And for this experience, you need certain applications like Google Expeditions, Creator AVR, and ShareCare-U. So the paradigm shift, why are we talking about immersive technology today? We're talking about immersive technology today because we are used in most institutions of learning, universities, high school, it doesn't matter. Most learnings are still done in the traditional methods. What do I mean traditional methods? These are conventional methods of just reading textbooks, as you can see here, and sometimes having anatomical models or mannequins, and as you can see by the left. But the question is this really enough? Medicine is tough, medicine is complicated. Can we still maintain learning and still producing good results to match up with the expectations in the 21st century? I think no. And that was why at our department, we decided to take up this challenge and create a state-of-the-art technology to help and facilitate learning. So if you can compare real quick, learning in this method alone and what you're about to see. So this is a virtual reality. And you can see students have the ability to detach all parts of the human organism from the skin to the deeper surfaces. And they have the feeling that they are in this, they are performing these procedures by themselves. So this is what a virtual reality looks like in medicine. And at our department, we are able to provide this. And not just providing virtual reality, but we're able to combine. So we have immersive technology, which involves augmented reality and virtual realities, and we're combining it with the traditional method of learning. So at the end of the day, our goal is to facilitate learning, to have more efficient products of modern and intelligent, and of course, prospective medical doctors. So this is a little bit of how it works in our department. Virtual reality or immersive technology plus conventional, traditional means of learning. The next, as you can see here, is our dear professor, Alexandra Kovalchuk. He is also demonstrating how this immersive technology, virtual reality, how it works. And immersive technology as well grants students the opportunity to be able to not just have a 2D, which is two-dimensional view of anatomical structures, but they can play around with these structures by going through all forms of orientations, different layers, and to satisfy all forms of intellectual curiosity and challenges that a specific model in their field presents. And here is in one of the labs of virtual reality in the University Teaching Hospital in Groningen in the Netherlands. And you can compare this with what we have. So it means at our department, we have the state of the art and the latest technology anywhere in the world to learn immersive technology in medicine. So next, immersive technology and virtual reality gives students the opportunity to practice. So just imagine that a student has the opportunity to go through different layers of an anatomical model. For example, in a textbook, he or she can only see what has been drawn, but cannot manipulate these models, cannot manipulate these images. But virtual reality gives them the opportunity to have these skills. For example, in the right-hand side, here is a real life application of virtual reality in surgery. So you can see the doctor, you can see the surgeon here with his gadget, with his device, and they are neurosurgeons that are currently operating a patient with the aid of virtual reality. And also in surgery, some of you will become surgeons, some of you, it doesn't matter, will choose other branches of medicine. You can be able to see
you are performing cystoscopy at the end of the procedure
get the opportunities or trainees get the opportunities to feel that indeed they are performing some manipulations on anatomical models. As you can see, look at her. This is the pelvis, and this is a trainee. So she has real instruments.
And then I'm going to use my long Alice clamp to grab into the middle of the uterosacral ligament at that location.
And here she's describing a procedure. So after this, it becomes a lot easier to perform this in real patients.
And that's going to be where we're going to place her.
So the next is immersive technology. What are the common advantages? In a conventional or traditional anatomy lab, you will have place for cadavers, you will have place for mannequins, anatomy models. You need a huge space and huge infrastructure for this. And students will not have equal opportunity to simultaneously grasp as much knowledge as possible during this process. But with immersive technology, you can see it doesn't require much space. Here is our doctor, our colleague, demonstrating this for students. Each student has the ability to have this feeling, this experience at the same time. And also, immersive technology is being used in rehabilitation of patients. Here is a very interesting case of a 9-year-old girl with severe leg pain. She has difficulties on walking. You can see she has some clutches. Now it's time to play around with immersive technology. She is moving her legs. Moving her body. You see? And this is her reality. This is the virtual reality where she is. So what does this tell us? This tells us simply that if you look at this child without if you try to rehabilitate this child without some advanced technology like immersive technology, you will need more time. It will take more economical implications. But with such technologies, they find fun moving their bodies. And at the end of the day, they stay shorter in hospital and they are quickly discharged. And it's easier work for the hospitals and easier work for the patients and the family of the patients. Next is stress. We all undergo stress. Teachers, students, it doesn't matter. Stress is a huge problem in the 21st century. And to fight stress, a lot of people show anger or aggression on other people. But with immersive technology, we can redirect this energy to people having to fight stress at the comfort of their home, of their offices. As you can see, this gentleman by the left-hand side is playing a game called initial screaming. So screaming helps us to get rid of stress, or punching someone as well helps us to get rid of stress. But with his virtual reality, he's able to play a game that whenever he screams, he earns an extra point. So this is one of the ways as well to help us fight stress with the use of immersive technology. The next is, you can see, here is a patient. We all at some point of our life have been patients and will be patients. So for example, I don't like needles. I don't like getting my blood drawn. It hurts. I have phobia for this. And there are lots of patients, lots of people like that in the world. So how do we make them feel very comfortable doing some medical procedures or medical manipulations? Here is this gentleman. He's having his blood drawn and he's not feeling anything because this is his immersed reality. He's having a walk somewhere in Japan and in a lovely Japanese Zen garden. So he doesn't really feel the pain or the inconveniences that is being created by the physician. So this is one of the ways as well that we can apply virtual reality. The other part I would like you to see is the effects of virtual reality. So he's walking on a plank, and it feels like he's walking right there. It feels like he's falling down. So the point is that indeed people have this feeling, they express real emotions while immersed in a different reality. And sometimes this can help us to manage some cases of patients with maybe some PTSD, patients who underwent some trauma and they want to have experience of what the trauma was like, a second experience. But the difference is that unlike the initial experience, this experience is just a simulation and they can stop it at any time. And next is, what effect does virtual reality have in our brain? Now, this was conducted on students while studying, while reading conventional way of learning. So reading an anatomy textbook and atlas. And you can see the brain activity, the motor cortex activity in the first slide. There is very few activities, the motor cortex activity. And then here, virtual reality was introduced. And you can see the increase in reaction in the brain cortex during the use of virtual reality. So in summary, what are the learning advantages of immersive technology? So it really contributes to formation of orientation of components of education. So students have the opportunity to combine the theoretical things that we'll tell them and with the practical experience. Because if you remember, it's always easier for people to remember something when they have an experience. So you read a book and you experience it with the help of what? Immersive technology. Of course, it increases attention for students, the adaptation, the pace at which they learn, the learning curve is higher. And of course, in general, it increases motivation for students to learn. What is the distribution of virtual reality? Education takes over 56% of it, while tourism takes just 20% of it, and others 24%. But unfortunately, virtual reality is still not effectively applied in medicine. It's just 14%. And I hope after my presentation to you, you will be an advocate of virtual reality or immersive technology in all universities, both here and in your home countries. Further, advantages of virtual reality or immersive technology is cost effectiveness. They are pretty cheap. Just imagine how much money you need to set up. You need to use to set up a conventional anatomy lab, cadaver, anatomic models, and so on and so forth. So, but with virtual reality, you just need a gadget, a device, and you're good to go. So what are the few disadvantages of virtual reality? So we still don't have an effective way to measure its efficiency. We still don't have an effective way to measure its efficiency. And of course, students still, or the users don't really have the real feeling. It's just a simulation, so it's still not a real feeling. So those two limitations are quite paramount in highlighting the disadvantages of virtual reality. So in a nutshell, we mostly apply this technology, of course, in human anatomy, which we've described, and of course, it's still developing, and hopefully in a couple of years, it will get to its peak. However, there are some prospects in physiology, which we can try to simulate some cells and the cell membranes and organs and organelles, and as well in some systems like in the cardiovascular system, where we can simulate like the heart rate, blood pressure, and so on and so forth, and even diseases as the case may be. So this I already told you about. So what are the prospects? The most important prospects for me, for us to put into consideration is that we are looking for a way that hopefully in the future, immersive technology will be adopted by all institutions of learning as part of the curriculum. Because as we've described, it optimizes learning process in all ramifications. So to conclude, this is a research from the University of Maryland in the United States of America. They compared the accuracy of memory recurrence from some subjects. So desktop computer in comparison with virtual reality. And the result is that virtual reality has more accuracy by 9%. And by the right is also another research conducted by this company. It's called 3VR. They compared traditional training and training with virtual reality. And guess what? The learning curve is faster by 12%. So my question to all of you is a very philosophical one, and at the same time, a rhetoric question. To be or not to be, just as it was asked by Shakespeare in his play to Hamlet. Should we just settle with the conventional way of learning by just reading textbooks and going to anatomical dissection once in a while? Or should we choose another option, which is to be, and adopt, accept, apply the use of immersive technology in learning? I think the answer you all would choose to be like me. At that level, I want to thank you so much. These are some of my references, and thank you so much for participating and listening to my presentation. And I want you to stay safe. The pandemic is still on, and not just wear masks, but wear your mask properly. Thanks again.